Welcome to the last session of our topic, that is post encore. In the last class, I have explained about split post encore with the help of clinical pictures. Now let's go to the resistance form and its connection with stress distribution. As you all know, as the post length increases, the chances for stress accumulation decreases. They both are inversely proportional to each other. So it is always better to go for the maximum allowed length of the post in all the cases. All the sharp angles has to be avoided in almost every dental procedures. That rule has to be followed strictly in case of post encore also. In last class, I have showed you a picture of cement escape vents. The importance of cement escape vents in case of custom made post was explained in the last class with the help of a clinical picture. So it is always mandatory to give a cement escape hole vertically in order to avoid stress accumulation inside the post space. This is the picture showing the vertical cement escape hole in case of post fabrication. When you use a prefabricated post, it is always advisable to check the case sheet. During root canal treatment, during biomechanical preparation, they have mentioned the file sizes which they have used in order to increase the root canal size. You should note the last used file, the size of the last used file, and take it as a standard before performing post-encore procedure. You are not allowed to increase the size of post space by 1 or 2 instrument sizes than the standard one which you have selected previously. Here they have showed the diagrams of 3 teeth which are numbered A, B and C with the post on it. The number A is incorrect due to the presence of the narrow post which was placed. As you all know, the post diameter has to be 1/3 of the root diameter. That rule is not followed in number A. Now let's go to number B. That is also incorrect due to the presence of a huge dead space. You can appreciate a dead space over here, which is due to the inadequate length of the post. So this dead space will be filled with the cement, and as the length of dead space increases, that will reduce the success of post encore procedure. So all the dead spaces has to be eliminated and has to be filled with the post. Now the third one is the perfect post encore procedure which you all supposed to do. The need for aesthetic restorations have drastically increased these days. That reflected in the area of post encore also. Hence, they have invented zirconia posts to solve this problem. They are parallel sided solid posts. They have increased structural strength and biocompatibility when you compare with other posts which are available in market nowadays. But they are having a huge disadvantage, that is the stiffness property. For example, if you apply a certain amount of force laterally onto a tooth, that tooth tries to bend to an extent. That is due to the elastic modulus property of that particular tooth. That elastic modulus property is very less when you compare a tooth with a zirconia post. Zirconia post doesn't bend much due to its stiffness property. It is stiff, so it won't allow any kind of bends, or it will allow very less amount of bend when you compare with a tooth. So what will happen if a zirconia post will not bend and a tooth bends easily? When you cement a zirconia post into a tooth and you apply certain amount of pressure laterally, that tooth tries to bend, but the zirconia post which is cemented inside will not allow it. That will create a huge amount of tension within the tooth or within the junction between the tooth and the zirconia post. It will result in a fracture very easily. So if you are planning to place a zirconia post, make sure you are placing it on correct measurement. That means the length of the post has to be correct according to the theory what you have learned till now. So that is the main disadvantage of zirconia post, and it cannot be etched. That can be solved by sandblasting. They can be sandblasted, so that can be solved. And the retrieval of zirconia post due to any reason is kind of impossible. You cannot retrieve it at any cost. It is very difficult. So you just forget about retrieval. If you need to retrieve it, it is better to extract the tooth and go for any other methods to rehabilitate it. And the zirconia post can be cemented with self-curing resin composite cement, that is Penavia 21. Let's go to fiber reinforced composite post. So many experiments are being conducted in order to improve the mechanical properties of strength, fracture toughness, stiffness, and fatigue resistance of fiber reinforced composite post. There are so many materials they have incorporated to get better properties all these days. Initially, they have used carbon fibers to reinforce these kind of posts, but carbon fibers were in black in color, hence they were highly anesthetic. So they discontinued the uses of carbon fiber nowadays. Then glass fibers came into the market. Then silica woven polyethylene, then ribbon fibers, all are incorporated recent days. The recent advances in fiber reinforced composite includes the incorporation of fibers, which are not only improves the strength but also helps to match the elastic modulus of post, which is similar to the tooth, hence preventing the fracture at the junction of post and core. Post and core is an effective method in restoring fractured tooth. It can be a life-saving tool to restore a broken crown or FPD. But before attempting it, you should be thorough with the basics like types, indication, contraindication, advantages, and disadvantages of post and core procedure. I wish you all a very good success in the area of post and core. If you have any doubts, please don't hesitate to clear it. Thank you.